My name is Jan Sleeper. I met Louis on a cruise, and we were in Russia, and he was a cruise host, and he would dance with the ladies, and he danced with me, and I was on the cruise as a nurse, and that's how we met, and he invited me to Tucson, and I didn't come right away. I waited for about 2 weeks to come visit him, and then I came down and we just started traveling, and he was kind of this old school, like you don't live together unless you're married. So it was a quick decision, yeah. We were married almost 20 years. In 2006, he got macular degeneration and he had to start taking injections, and so I had to start driving. And then he had heart surgery, he had kidney stones, and when they were doing the aortic aneurysm, they were taking ultrasounds, and they found a spot on his lung. He was here at the house with hospice for 6 weeks. It was a wonderful experience.
It was my great honor to take care of Louis Sleeper while he was a patient with us here. So I love working with the veterans here. We have a lot of them.
And Mr. Sleeper, in my visit, my first visit with him, it was just, you know, he jumped at the chance to talk about his B-17 flying. His eyes lit up, he smiled.
Here's the B-17, a little model of what he was shot down in. There's with the crew, the plane. There were 10 of them, and 5 didn't make it, and the other 5 bailed out.
Sometimes, you know, these guys have they saw action or served, you know, decades ago, and it kind of gets forgotten a little bit. And it's wonderful to be able to come back years later and just honor them for what they did.
It was like we were being carried along. We left the hospital, and they brought all the equipment. They brought Louis in, and they just were all here. The nurses, the social workers, everybody was here. And she said, we are going to be setting up military personnel to honor your husband, and we want to do it soon. And what she was thinking of is that they had to do it soon. And I said, okay. And I didn't know exactly what was going to happen.
So then when we were able to arrange, through working with his wife and through the social worker, bringing the plaque and bringing the quilt and the pin and the things that we try to offer to our vets when they're in home care or as a patient here, there was just kind of an outpouring of connection from many, many other active duty and reserve military people.
They asked him questions, which helped, which jogged his memory. And then they looked at his pictures behind me here, and he told them about how old he was when he joined. And then he got them to talk about what they did too, because he was interested in that.
And his wife asked him to tell us about his time in World War II. And then we all kind of stood there enthralled by who he was and what he had to tell us.
And it means a lot to the families as well, that we are going back and showing some recognition for things they did, you know, maybe 40, 50, 60 years ago now.
And it brought us all to tears, you know, so it was wonderful.
As a veteran, they provided something to our country. So we give thanks to them for their service, whether it was very short or whether it was, you know, 30 plus years, and just truly appreciate that.
It's a great honor to be able to take care of them at the end here.
Of course, I'm just grateful, and I was shocked that they went to all that trouble, and I think it's wonderful, of course, for him and for me too. You know, I'm going to remember him like that, and that they were grateful. The young ones were grateful for the old ones that were before them, and they're grateful for the young ones that are keeping us free today.
The more we can do for one person, the better. And our hope is that through Rock N Rodeo, we're enabled to do more things for not just more patients, but for each patient one at a time.
You know, a lot of these vets came back from combat situations, and some fared fine and moved on with their lives real well. Others did not. They've suffered a lot. They've put their lives on the line. They've lost a lot of friends. They've got a lot of health issues, the psychological scars. And, we tend to sometimes forget that. It's a long time ago now.
The hospice program, the We Honor Veterans program, is intended to just do more. And some of our doing more asks that and depends upon having more resources to do those things.
Them coming out just reinforced that somebody's paying attention, so TMC Hospice was paying attention to the veterans.
Everyone nowadays says they support veterans, they support our soldiers overseas, and that's great. I mean, this is a great opportunity to be able to, put your money where your mouth is, and these funds will go to support programs that do support our vets directly, and they definitely still need our help. They deserve our help, so anything you can do would be greatly appreciated.